Should we trust AI like ChatGPT for health advice, or is it too risky? Well, it really depends on what you're using ChatGPT or other chatbots for. They're really good at translating medical reports into plain language. They can help turn complex language into age-appropriate language, so it's easier to communicate with young people. They provide useful summaries of information on diseases. They can also plan meals for people who need specialized diets like diabetic diets or Mediterranean diets. Do not ask a chatbot to diagnose your chest pain, and that's because chatbots are sycophantic. They are designed to agree with you, which means they're going to drive you down a path of inquiry that's probably going to be misleading, whereas your healthcare provider may ask you a question that appears to come out of left field because they know something that you don't know. It's not random. It's because you've said something that's triggered what they've said to examine another potential disease that you might have. Another reason why you should not engage chatbots for direct medical information about your own health is because you may be providing information, you may be sending information out there that tells people what diseases you have. Like, for instance, you're never going to ask a chatbot, my PSA was so-and-so, what should I do about it? Because you're telling the world you have an elevated PSA, which means if an insurer ever gets wind of that, they might cancel your insurance. Instead, ask, what are the reputable scientific-based websites to answer the question of what to do about an elevated PSA? That is a more neutral form of the question, and it doesn't telegraph to the world that you have a particular disease. So don't ask ChatGPT to diagnose your chest pain. There's another specialized area. Do not ask for mental health advice or engage in counseling with a chatbot. In fact, that's becoming increasingly popular. There's a study that showed that 13% of young people ages 12 to 21 have even more, 22% of people ages 18 to 21 have asked a chatbot for counseling advice for mental health issues. We know that there's a high prevalence of mental health problems in young people these days for a whole bunch of reasons, partly because of social media, because of access to smartphones, post-pandemic, and a whole bunch of other factors. Why shouldn't you ask a chatbot for counseling advice? Because the algorithm is designed to agree with you. It's sycophantic. That's what they call it. If you, for instance, have a psychosis, an underlying psychosis, where you have a formal thought disorder with delusions either of persecution or delusions of grandeur, and you start talking to a chatbot about having invented the universal theory for quantum mechanics or quantum computing, and you ask that chatbot, am I crazy for thinking I'm onto something? That chatbot is going to say, no, you're not crazy at all. You're definitely onto something. You should continue on this important area of research because what you're doing is very, very important. And there actually are reports that if you asked the chatbot, I think I'm being followed, I think the CIA is trying to follow me, am I crazy or could I be right? Chatbots are not designed to say, no, that is a delusion, you should seek immediate emergency help, call your healthcare provider, or go to the nearest emergency department. Instead, it will say, yes, indeed, you are onto something. You are being followed because what you're doing is very important, and of course the CIA would be interested in what you're doing. There is actually an entity known as AI psychosis, is a thought disorder that is associated with AI use. Now, we don't know if the AI caused the psychosis or triggered the psychosis, but there are case reports of people who have started hearing voices telling them to do things like harm themselves or harm others. They've had paranoid delusions of being followed or having radio waves beamed into their head or thoughts taken out of their head. And certainly, even if the AI, the chatbot, didn't cause the psychosis, it contributed to it, and it was like pouring gasoline on a fire. The makers of algorithms need to redesign and re-engineer chatbots to put up guardrails for people who have mental health issues, to make them less sycophantic, to provide an opportunity to challenge what the person is saying. Certainly one person I know who suffered from AI psychosis told me what helped was to engage in a second chatbot, because the second chatbot turned out to be less agreeable, less sycophantic than the first one, and that helped them realize that they were just being fooled. We are in the early days when it comes to AI diagnosis or AI counseling. Don't ask. The bottom line is, don't ask a chatbot for advice on how to manage a problem, to help you diagnose something, and certainly don't go to a chatbot for counseling in this day and age.